morning. I'm Dr. Deuk, CEO and founder of Deuk Spine Institute. I'm here with one of my patients who traveled from
Chicago,
Illinois to Florida to have, what procedure did you have done?
I had the Deuk laserspine procedure.
Good. The Deuk laser disc repair. I think I made the name too long, but
I think so.
Deuk laser disc repair is a repair of a herniated disc, and the reason it's a repair is that all the other procedures today that are available in the spine surgery world are not repairs of the disc, but they're fusions of the disc or artificial discs. In both of those situations, you literally have to clean the whole disc out, you get rid of it. As a surgeon, you take it out of the patient and then you put a metal thing in there, screws and rods, or an artificial disc. And then the other thing you can do is something called a microdiscectomy. But for a microdiscectomy, the surgeons are drilling away part of the spine, the bones and the joints, and that destabilizes the spine every time and weakens the spine. The patients are always going to come back for more surgery at the same place. So we found a way to repair herniated discs using a laser and an endoscope through a transforaminal approach, so there's no damage to the spine whatsoever. You had this done yesterday. You came from Chicago because nobody else in the United States does this surgery. And before surgery, you had the left leg numbness and weakness of your foot.
Correct.
You had some back pain, but your primary problem was the numbness in your leg. And the nerve was so badly damaged that the pain had even gone away, and you were starting to hurt your ankle from the way you were walking because you couldn't feel where your foot was as you're walking. So how are you doing today, just 24 hours later?
Great. Unbelievable.
Yeah? Good.
Unbelievable. It's amazing. You're amazing.
Thank you.
So I would recommend from around the world to come to see Dr. Deuk.
Well, thank you. So you went home like an hour, like less than an hour after your surgery, right?
I
Or
did.
back to the hotel?
Back to the hotel, correct, yeah.
And you're eating and drinking normally?
Everything normal, yeah.
Are you taking powerful pain medication for your surgery?
No, in previous, I was taking several powerful medications on a daily basis for over 4 months.
Yeah, and with the Deuk laser disc repair, you didn't have to take powerful painkillers after surgery.
No,
What
not
did
at
you
all.
take for pain?
Nothing.
Nothing. And that's fine. Some patients will take Tylenol. The reason, folks, is the cut on her back is this big. Now, I did the surgery on the spine, but her cut is tiny and she's not taking any pain medication. So had you gone to another surgeon who would do a fusion or an artificial disc for your problem, you would be on powerful painkillers, doped up right now in the hospital on a morphine PCA, and just laying there in bed waiting to get pneumonia or blood clots. And here you are,
Yep.
24 hours later, you're going home, aren't you?
Yes,
When do
we
you
are.
all leave for Chicago?
Tomorrow.
All right, so you're going to have one more beautiful day in Florida, right? And then you got to go back to Chicago.
Where it's cold.
Yes. Now, were you offered a different surgery for your back?
Yes, I was offered a different surgery. At first, they did not tell me what they were going to do on my back. They just said, call my office and let's schedule your back surgery. So I obviously wanted to know more about that.
Yeah. And how did we first meet?
We first met from my mother-in-law, Suzette, who's been here twice.
Yeah.
Now this is her third
She's had her
time.
neck and her
So-
back both fixed, so
Correct.
she brought you.
So she brought me here.
And we met over the internet,
yes.
right? By Skype.
By
We did a video conference, telemedicine, so to speak, and that went pretty well.
That went really well.
And we told you exactly what we do to fix you.
Exactly. Yep.
Yeah.
Detail, word by word. So yep.
So a few things to learn from this interaction. Number one, obviously the Deuk laser disc repair, very minimally invasive, great way to fix herniated disc, pinched nerves, back pain, leg pain, numbness, tingling, weakness. And your strength is back to normal basically in your left foot today. The other thing to learn is that a lot of doctors don't tell their patients what they're going to do to fix them because the truth is they don't know. They're going to go in there and they're going to root around and a lot of times patients end up coming out of those kind of surgeries a lot worse than they went in. And that's why back surgery has a bad reputation. Your surgeon should know exactly what they're going to do during the surgery before they take you to surgery. A good surgeon always knows, based on the imaging, the physical exam, the patient's complaints, and any other diagnostic tests like CAT scans, x-rays, or EMGs. Using those tests, we can know exactly what needs to be done on our patients. And we did exactly on her what we knew we would do ahead of time. And that's how it is 100% of the time at Deuk Spine Institute. And then the third thing we learned is that back and neck spine surgery can be done without patients needing painkillers after surgery, as long as it's done properly. And that's the Deuk laser disc repair endoscopic surgery. Our patients usually don't take any painkillers after surgery. Whereas any other type of spine surgery you get, you're going to be doped up for days and weeks and possibly months, addicted to narcotics. So it's a much cleaner, safer, better surgery for people. Anything else you want to add?
Thank you for this
Oh, you're welcome.
so much. I'm gonna start to cry.
Oh.
Thank you so much.
Yeah, you're welcome. You're welcome. That's why we're here. That's why we're here. You're welcome. You're welcome. All right, you guys have a safe trip back home, okay?
Thank you.
You're welcome.